All right, Nick Goodwin here, Goodwin Health Cafe, GoodwinHealthCafe.com. And I want to define integrative psychiatry. Okay, what does it mean when we use the word integrative? You've also heard functional, you've also heard orthomolecular, you've also heard holistic. And so sometimes we start thinking about, now we're thinking about essential oils or whatever, and we start thinking that, well, this isn't scientific anymore. This isn't what the research shows is effective, and I want to use interventions that are research approved. And so I kind of want to sort of break some of that stigma down a little bit and emphasize how medications, even in the standard of care of psychiatry, so even in psychiatric treatment, medication should never be the only intervention and only option. Good psychiatry will always involve dietary modifications, lifestyle adjustments, encouraging regular exercise, and therapy. They are already a part of it. And so I want to kind of give an example when we're talking about specifically depression treatment. I want to talk about serotonin.
So serotonin is certainly one of the chemicals that we consider as to be very involved in our happiness and also involved in depression when deficient, as it is also in the medication that we usually prescribe for people with depression or anxiety. But serotonin itself has some important metabolic processes that we should consider when treating depression. Initially, it starts as tryptophan, which is an amino acid, an essential amino acid that we get when we eat protein, which then converts to 5-hydroxytryptophan, which then converts to serotonin. Now, in order for these metabolisms to happen, we need vitamin D, folate, vitamin B6, and zinc. But the issue here is, so serotonin can't cross the blood-brain barrier, which is why we just can't give somebody synthetic serotonin and increase their level. So in order to get serotonin in the brain, we have our protein, which part of which is tryptophan, and tryptophan can't cross the blood-brain barrier, but there is an active transport there which can transport tryptophan across. But the main problem is that tryptophan has to compete with that transporter with all the other amino acids. And tryptophan itself is not a very large molecule, nor is it really that abundant in protein. And so how do we get tryptophan across the blood-brain barrier? Well, when our body releases insulin, all of the other amino acids that are waiting in line to get into the brain are used to metabolize that insulin, or that insulin process. So tryptophan then has front access to get into the brain, to turn into 5-hydroxytryptophan, to turn into serotonin, and still requires these other elements in order for that metabolism to happen. So there are lots of different components here that are essential. Carbohydrates is essential because that's what gets our body to produce that insulin when we're trying to get the tryptophan across the brain. And when we look at treating for serotonin deficiency, we're treating depression with serotonin agents. The way we do it is we block the recycling of serotonin. So when serotonin is available, we inhibit the process which reuptakes it, so more serotonin is made available. But if there is not enough serotonin in the body already, then this process isn't going to be as efficient because there's no serotonin to stop recycling to begin with.
There's a lot of interventions that we can use to treat serotonin deficiency, or depression that we associate with serotonin. There's also ways that we can measure that. And that's really the basis for an integrative approach, is that we do assessments and we do measurements, and sometimes we do labs where we're able to try to identify what specific deficiencies likely exist, or what specific nutrients or supplements or hormones can we use to improve your mental health. And a lot of times we're talking about some pretty quick results, because a lot of times the medications can take a while and have side effects. And so that's what I'm hoping to do. I will post more videos about examples of this. Check out my radio show where I talk about a lot of mental health issues in lots of detail, including treatment. Health Cafe Radio on 12:30 a.m. And also follow us on social media. All right, you guys, peace out.